this video, we're going to focus on a very practical topic: how to prevent blackheads when your skin is unpredictable. Some weeks you feel oily and congested, other weeks you feel dry and sensitive, and you're not sure whether you should exfoliate more or back off. This is exactly where many people get stuck, because they respond to every change by switching products, scrubbing harder, or stacking actives, and the pore never stabilizes. Blackhead prevention is not about intensity. It's about keeping the pore environment steady and keeping your skin barrier calm enough that you can stay consistent. This is general skincare education, not a personal medical diagnosis. If you have severe acne, painful deep bumps, significant scarring, frequent infections, eczema, rosacea, or if you are pregnant or nursing, it's best to speak with a qualified healthcare professional before starting strong active ingredients. Let's start with the basics in one sentence. Blackheads are clogs made of oil and dead skin cells, and the dark color is oxidation at the surface. They are not dirt. So the goal is not to clean deeper. The goal is to prevent the plug from forming by supporting normal shedding inside the pore and reducing the triggers that repeatedly refill pores. The biggest trap is that blackheads make people want instant results, and instant result behaviors are often the ones that cause long-term congestion: harsh cleansers, daily scrubs, frequent pore strips, aggressive squeezing, and layering too many strong products. Those things irritate the pore opening and the surrounding skin, and irritated pores tend to refill faster and look larger. To prevent blackheads when your skin changes week to week, you need a routine with 2 layers: a stable base routine that you do every day, and a flexible active schedule that you adjust gently without panic. Your stable base routine has only 3 goals: remove sunscreen and daily build up effectively at night, keep the barrier hydrated and supported, and protect from UV with sunscreen in the morning. If you do those 3 consistently, your skin becomes more predictable, and blackheads become easier to control. Let's build that stable base routine. In the morning, decide whether you actually need cleanser. If you wake up oily or sweaty, use a gentle cleanser. If you wake up comfortable or slightly dry, rinse with water. Then apply a lightweight moisturizer if your skin needs it, and apply sunscreen. Sunscreen matters not only for anti-aging but also for blackhead prevention, because UV exposure can thicken the outer layer of skin over time and worsen uneven shedding. That uneven shedding can contribute to clogged pores. Many acne-prone people skip sunscreen because they fear breakouts, but very often the real issue is the sunscreen texture or incomplete removal at night, not sunscreen itself. Choose a sunscreen texture that feels comfortable. Many people do well with lightweight fluids or gels, and focus on removing it properly at night. At night, cleansing is where most prevention routines quietly fail. Sunscreen is designed to stick to your skin. Makeup is designed to stay in place. If you wash quickly and leave behind a thin film, that film mixes with oil and dead skin inside pores, and blackheads refill no matter what active ingredients you use. So if you wear sunscreen daily, which you should, you may need a 2-step removal process. First, something that dissolves sunscreen and makeup, like micellar water, a cleansing balm, or a cleansing oil, followed by a gentle water-based cleanser. This does not have to be harsh. It's about using the right type of cleanser for the job. Your skin should feel clean and comfortable afterward, not squeaky and tight. Tightness means barrier stress, and barrier stress increases irritation and congestion. After cleansing, you moisturize. Yes, even if you are oily. The barrier is not your enemy, it is your skin's protective system. When the barrier is weakened, the skin becomes more inflamed and reactive, and shedding becomes less organized, which can worsen clogs. Choose a lightweight moisturizer that does not feel greasy. Ingredients like glycerin, ceramides, and panthenol can support the barrier. Niacinamide can help some people regulate oil and support the barrier, but it can irritate a subset of people. If niacinamide makes you sting or flush, pick a simpler moisturizer. A comfortable moisturizer is a prevention tool because it helps you tolerate your active ingredients consistently. Now let's move to the flexible layer, your active ingredient schedule. There are 2 main pore normalizing strategies that have strong evidence for blackhead prevention: salicylic acid and retinoids. Salicylic acid is oil-soluble and can move into the pore lining to loosen the oil and dead skin mixture. Retinoids normalize cell turnover and reduce the tendency of dead cells to clump inside follicles, preventing microclogs from forming. Both can work. The key is not picking the strongest product. The key is picking the product you can use consistently without irritating your skin. If your skin is oily and you mainly struggle with clogged pores on the nose, inner cheeks, and chin, salicylic acid is often a practical starting point. But the right way to use it is not daily high-strength exfoliation. The right way is steady maintenance. Start with a salicylic acid leave-on product 2 or 3 nights per week. If your skin stays comfortable, you can gradually increase. If you get burning, persistent redness, or peeling in sheets, reduce frequency and focus on moisturizer. Some people do better with a salicylic acid cleanser used a few times per week because the contact time is shorter and irritation risk is lower. You may see slower progress, but stable progress is what matters. If your skin is more sensitive, or you want a long-term strategy that also improves texture and helps prevent multiple types of acne, a retinoid can be a good option. Retinoids are powerful, but they require patience. Use a pea-sized amount for the entire face, applied at night to completely dry skin. Start 2 nights per week, then build to every other night if tolerated. More is not better. More often creates irritation, and irritation can worsen congestion. If you experience dryness or sensitivity, buffering helps. Apply moisturizer first, then retinoid, then another thin layer of moisturizer. Buffering is not weak, it's how many people stay consistent long enough to see results. Retinoids often take 8 to 12 weeks to show noticeable improvement, with continued improvement over months. If you are pregnant, trying to conceive, or nursing, do not start retinoids without medical guidance. Do you need both salicylic acid and a retinoid? Most people do not need both daily. If you combine them, alternate nights rather than layering them together. Layering increases irritation risk, and irritated skin is more likely to clog. And remember, rest nights are not wasted. A rest night where you use only moisturizer is often what allows you to keep using your actives for months instead of quitting. Now here's the real key to managing unpredictable skin: you adjust frequency, not products. When your skin feels oilier and more congested, you might increase your salicylic acid frequency slightly or keep your retinoid schedule steady and make sure your cleansing is thorough. When your skin feels dry, tight, or sensitive, you reduce your active frequency and increase moisturization. The core routine stays the same. You do not respond to dryness by scrubbing more, and you do not respond to oiliness by stripping the barrier with harsh cleansers. You respond by nudging your schedule. This is how you keep the skin stable and prevent the stop and start cycle that fuels blackheads. Now let's cover common hidden triggers that make prevention harder. Hair products are a big one. Oils, pomades, thick conditioners, leave-in products, and styling creams can migrate onto the forehead and hairline and contribute to congestion. If you notice blackheads near the hairline, keep heavy hair products away from the face, rinse conditioner thoroughly, and consider washing your face after styling if product touches skin. Sweat and friction are another trigger. Masks, helmets, straps, and tight hats create heat and friction that swell the pore opening and trap oil and sweat. The solution is gentle cleansing after sweating and avoiding heavy occlusive products in those zones. Makeup can also contribute if removal is incomplete, and makeup tools like brushes and sponges can hold oils and residue. Cleaning tools regularly can reduce congestion. Now we must address extraction and quick fixes. Pore strips, aggressive squeezing, and harsh scrubs can make you feel like you're solving the problem because you see something come out. But they often irritate the pore opening, leading to faster refill and a more visible pore appearance. Also, what pore strips pull out is often sebaceous filaments, which naturally return. If you do extraction at home, keep it rare and gentle, and never dig with sharp tools. For stubborn congestion, professional extraction is safer and often more effective than repeated home trauma. Clay masks can be supportive for oily skin, but they should not be used as a punishment. If you use a clay mask, apply a thin layer, rinse before it fully dries and cracks, and moisturize afterward. Overdrying can trigger irritation and worsen congestion. If you are sensitive, you can skip masks entirely. Let's talk about how to measure progress so you don't get discouraged. Blackheads improve slowly. With consistent salicylic acid use, many people notice smoother texture within a few weeks, but meaningful reduction often takes 8 to 12 weeks. With retinoids, visible improvement often appears around 12 weeks and continues over months. The worst habit is changing products every 2 weeks. Skin needs time to normalize. If you want to track progress objectively, take a photo every 2 weeks in the same lighting. Day-to-day mirror checking can make you overreact and overtreat. You may also hear about purging, especially with retinoids. True purging usually happens in areas where you already clog and gradually improves over several weeks. Irritation looks different: burning, persistent redness, itching, rash-like bumps, or breakouts in new areas. If you suspect irritation, pause the active ingredient, focus on gentle cleansing and moisturizing, and restart more slowly if appropriate. There is no benefit to pushing through severe irritation. Irritation can worsen acne and increase marks. Now, here's a simple, realistic maintenance structure you can follow. Morning, gentle cleanse only if needed, moisturizer if needed, sunscreen. Night, remove sunscreen thoroughly, gentle cleanse, active ingredient on dry skin according to your schedule, moisturizer. If your skin is stable, you can slowly increase active frequency. If your skin feels irritated, decrease frequency and prioritize barrier support. This one routine, adjustable schedule approach is what keeps pores clear long-term. Finally, know when it's time to get professional help. If you have painful acne, deep nodules, significant scarring, or acne that affects your mental well-being, professional care is appropriate. If you followed a consistent routine for a few months and blackheads remain stubborn, a dermatologist can confirm the diagnosis and recommend prescription options or in-office treatments like professional extraction or chemical peels. Professional care can also help differentiate true blackheads from other skin conditions that can look similar, like milia or certain forms of follicular plugging. The takeaway for this video is simple: blackhead prevention becomes easier when you stop reacting emotionally to your skin and start managing it systematically. Keep your base routine stable: effective nighttime removal, gentle cleansing, daily barrier support, and daily sunscreen. Choose one pore-focused strategy, salicylic acid or a retinoid, and adjust frequency based on skin comfort, not based on frustration. Avoid harsh scrubs, pore strips, and aggressive squeezing. Watch for hidden triggers like hair products, friction, sweat, and incomplete makeup removal. Give your skin time, because pores change their behavior over weeks and months, not overnight. When you follow this approach, your skin becomes more predictable, your texture becomes smoother, and blackheads stop feeling like an endless battle, because you're finally working with your skin instead